It's a pleasure to see all of you here. Seth is the 10th speaker in our Active Knox speaker series. The event is sponsored by Active Knox, a partnership that includes ARC, Bike Walk Knoxville, the Knoxville Track Club, Legacy Parks Foundation, Knoxville Area Association of Realtors, East Tennessee Quality Growth, Knox County Schools, University of Tennessee, Community Partners, the Metropolitan Planning Commission, and the Knoxville Regional TPO. This group is committed to bringing innovative and proven ideas that can help make Knoxville, Knox County, and our region a more active, engaging, and economically vibrant place to live, work, and play. I also like to thank the Tennessee Department of Health, which provides funding for this speaker series, including our healthy snacks. And now it's my privilege to introduce our speakers. Seth. Seth is a research associate with the University of North Carolina Highway Safety Research Center, where he evaluates behavioral interventions designed to enhance bicycle and pedestrian safety and access. He is also the assistant director of the National Center for Safe Routes to School, an organization that focuses on improving the safety of children walking and bicycling to school. Seth's research draws from psychology, sociology, and systems science with a primary focus on studying youth traffic safety and finding better ways to share effective road safety practices. He is also a member of the American Planning Association and TRB's Pedestrians Committee. Please join me in welcoming him.
Well, first I just want to express appreciation for Ellen, who sort of reached out initially, and then Susan, who's carted me around everywhere, as well as Hannah and Caroline, of course, conveying my body here. So thank you, everybody. It's been a wonderful experience thus far, and I look forward to having this conversation with all of you. We're going to go on a bit of a tour. There's quite a few things that we'll cover and concepts, but the basic one is captured in the title, I think, is getting to this idea of safe systems. And I'll talk about what we mean by that, because it's sort of a jargony term, right? And when I talk about coordinated action, it's basically what we had talked about this morning, about how we are in our silos often, right? Or our cones of excellence, as some people like to call it. But how we can coordinate efforts more, funding, resources, all of that, toward actually envisioning a future where people aren't killed or seriously injured while traveling about. So I'm just going to start out with a general premise of what's happened nationally. We're going to go, again, sort of look at this on a national scale and then bring it down locally as well. So in general, here's the picture. Has anyone seen this before? This is from NHTSA, the National Highway Traffic Safety Administration. Yeah. The students in the back, yes, of course. You guys have seen that. There's been a lot of sort of patting ourselves on the back in the safety field until recently, because what we have seen actually is a recent uptick in fatalities after many years of decline. We used to have, if you look at this graph here, 50,000 people dying on the roads. Now we're hovering around 40,000. And the rate at which, when you control for vehicle miles traveled, so the exposure to risk of being killed, we're doing not too bad. But again, more recently, we're seeing more of an uptick. And there's all kinds of reasons for that, but we can get to. We can thank behaviors, such simple behaviors as clicking on your seatbelt for this. This is a huge one. It used to be quite low. Now we're at about 90%, so that's good. Improvements to car safety features. A lot of the improvements we've made over the intervening years have been in cars themselves, and particularly car occupants. When you look, they were pretty rudimentary in the beginning. You had hydraulic braking in the 20s finally introduced. Now we have forward collision warnings and even forward collision avoidance systems, and we're getting even toward more automated systems, right? Who here hasn't heard about self-driving cars in the last couple of years, right? It's all over the news. Lots of research groups are into this, both governmental and private sector. pedestrian detection or not that we'd seen recently. So it's mostly benefit, or the improvements have been in cars themselves for the occupants of those cars. And then when we look at head-on collisions, which tend to be the most severe, car-to-car sort of crashes that we document, guardrails and what are called Jersey barriers. I have no idea why they're called Jersey barriers, but the ones on the left there are called that. Those have really helped immensely as well. So when you look at the highway system and the cars, we've made a lot of progress, and that's where most of our safety benefits have occurred. But when you look at what other wealthy nations have accomplished, we are an outlier, and not a good one. So this is a graph by Brudet and Elvik. They pinned basically the highest rate, or a highest death rate year. So it looks like it was late 60s, 1970 for pretty much everybody. And then indexed everything every year after that to that point. And looked at as basically a reduction in fatalities. We have had a reduction in the United States, but look at where Northern and Western Europe has been over that time period, right? We have definitely widened the gap between us and the rest of the world. What do you think that might relate to? You see this sort of jumps. That relates to recessions. When our economy is not doing so well, people travel less. Therefore, fewer people are killed on the roads. Motor vehicle crashes continue to be the leading cause of death for this age group, 5 to 24. This is from the CDC. They document unintentional fatal injuries. Motor vehicle crashes for this group, still number one. Plus, we have these societal issues that we must contend with. Distraction. We hear a lot of media coverage on it. There's lots of simulation studies. Naturalistic driving studies, we're not entirely sure. The reason is people are distracted almost like 80% of the time they're driving. They're looking out the window, they're daydreaming, they're tuning the radio. They could be texting. They're doing any number of things. Eating. There's all these camera studies, that look at this, and people are doing any number of things. Combing their hair, putting on makeup, you name it. They're doing everything that they would normally do at home in the car. Drug driving, this is sort of an emergent issue. Certainly, who here hasn't heard about the opioid crisis that we have now? We're now entering a phase in a lot of places in polydrug use, so opioids plus something else. And we don't really know how that affects biology. This is a little cut off here, but automated and connected vehicles, especially as they saturate the market. There's sort of a race to market, right, among Google, among Uber, and GM, to get these automated vehicles out on the road. Well, given that the people keep their cars at an average of 11 years, it's going to take a while for them to actually saturate the market. So we're going to have multiple decades of mixed fleet. What does that look like, right? We're not entirely sure. We're seeing the continuation of the urbanization of the population, more people moving to cities, cities growing. And then the rise in the use of SUVs more recently. So this is an IAH study looking at pedestrian safety and basically the risk of death for a pedestrian when they're hit by an SUV versus a typical car. As you can imagine, the high profile of the SUV is much more dangerous. And this relates to what we're seeing. Again, this is a slide from NHTSA. There's the shifting of the burden from those inside the vehicles to those outside the vehicles. We're seeing an increase in people, so pedestrians, cyclists, motorcyclists, other means of conveyance outside of vehicles. They're being killed at a rate much higher in more recent years, and we're protecting people inside the vehicles. So there's a bit of a shift that we're seeing there. And then we also have these persistent safety issues. So they're not even emerging. They've just been with us for a while, and we haven't really done much with them. So one example is pedestrian crashes. Did you know that 70% of the more fatal and serious pedestrian crashes occur at nighttime? When we think about even countermeasures for pedestrians, we often don't even reference nighttime. They're often tested out in the day and observed during the day. What about night? And then, of course, in the last 25, 30 years, we haven't really done much with drunk driving. Still about 30% of fatalities involve alcohol. We have not really budged that. So there's what I'm going to basically suggest today is that it's less a technical issue, it's more of a cultural, social problems that we see. So we would like to make swift improvements, right? There are things that we can do right now that would greatly improve people's safety on the roadways. But what stands in the way? Anyone hear of this phenomenon, compassion collapse? It is very real. So I was at a conference in Atlanta. It was the Governor's Highway Safety Administration conference, and one of the refrains there was, 40,000 people die on the roads every year. Where's the outrage? Your outrage is hiding right here. Once we get to a number that people, it's hard to visualize, once they feel like it's helpless and it's too big of a problem, their compassion just totally dissipates. It's just a natural human thing, right? So how do we get beyond that? Certainly we can talk about stories, individual stories, things like that, but there's something we have to contend with for sure. The innovations we do have. So think about how easy and simple it is to put on your seatbelt, right? Very simple act. It took us 33 years to get to 90%. The first seatbelt law was actually in North Carolina in 1985. And it took 33 years to get to 90%. You saw that graph before. It took a while, right? So what about more complex behaviors than just clicking on a seatbelt? What about speeding? How are we going to address that, right? Non-evidence-based. So this is something we talk about a lot, is that there's a lot of things being done, they're just not evidence-based at all, right? And it takes the oxygen out of the room. There's no more room to do anything because they're already doing so many things that don't really affect anything. And what this study here, this was a sort of commissioned study. They called them feel-good programs, but basically what you could call them was awareness-raising programs. So did you know, all these kind of did you know campaigns and things that try to raise people's awareness of the problem, of speeding, of drunk driving. Those have virtually no effect, but people keep using them because they feel like they're doing something, right? And that's the problem. It's not a problem necessarily, but when you're focusing your effort on things that don't work, you don't have effort left over to do things that do, right? So this is something that we have to also contend with. Nonetheless, because I just painted a pretty dark picture, so my apologies. That bourbon and fireplace sounds great right now. At all levels, we're starting to see really signs of improvement. Things like the Road to Zero Coalition. Earlier today, we had a meeting with the team, the Road to Zero team here, which was great. Road to Zero, double down on what works. So that's the premise is that we generally have an idea of how to improve road user safety. So let's double down on that. Okay. Advanced technology, things like ITS, intelligent transportation systems, connected vehicles, vehicle to pedestrian, pedestrian to vehicle, vehicle to vehicle, and vehicle to infrastructure. All these ways of communicating so we can warn each other before something terrible happens. And then prioritizing safety. When you read this report, it basically reads as creating a culture, a traffic safety culture. How do we get to a point where safety is always prioritized in every project? That's sort of what they're looking at. The state DOTs, anyone here toward zero deaths? So okay, we got one. You want to explain it? It's a very, very simple concept.
Yeah, you're working everything you can to get it down to no traffic fatalities.
Very, very well put. Yes, exactly. So states tend to call zero initiatives toward zero deaths. Cities tend to call it Vision Zero. They're all the same. The Road to Zero is the national initiative, right? It's all these zero campaigns. It's the idea that these crashes, the real serious ones, the fatal ones, are avoidable. And let's do everything we can to get there. So this is something that states have put in since sort of the late aughts. Working goal toward zero deaths. They focus mostly on the sort of the highway system and the transition zones into towns and cities. And then again, you see this idea of this traffic safety culture. What exactly does that mean, right? Traffic safety culture. There's been papers written on this, and we still, I don't think, have a good sense of what that actually means. But that's something we'll talk about. It sort of is, right? Yeah. I think most people see transportation sort of as a background, not unlike the electrical grid. It's just sort of there for them, their convenience, right? You sort of get on it and you get to where you need to go. It's not like, yeah, it's a bit hard to wrap your head around. And then some states and cities actually are starting to do more of this work. So the spot safety approach is what we, sort of a traditional approach. Where are we having our crashes? Let's fix those areas, right? What that amounts to being often is sort of playing a game of whack-a-mole, right? You hit one spot and then it emerges over here and then you hit that, and you're endlessly chasing your tail, basically. The more proactive approach what we call a systemic approach or risk-based approaches. We know that these characteristics in these types of environments are risky. So therefore, before anything even happens, let's get out there and let's make it safer. And then systematic is just making improvements everywhere, regardless of just making it really safe as you possibly can everywhere. In Knox County, we have complete streets guidelines. In fact, when you looked at where places adopted over time, where places adopted complete streets guidelines, Knox County is sort of an early adopter. That's what this graph kind of shows here. We looked at cities over 100,000, so what considered the sort of lower end of mid-sized cities and up. And we looked at basically the year of adoption of some complete streets policy. And we'd seen this trend. So you see here 2009 is sort of before it really took off. Consider Knox County an early adopter in complete streets. Does anyone know what this curve is here? The shape of that? That's called a diffusion curve. It almost always happens like this. So the narrative is, in the beginning, you have a couple crazy jurisdictions or people adopting something, say a smartphone, right? And then they get a couple more people. It takes a little while. You got an early adopters. It hits this point right at about that 15%. It hits what's called critical mass, or a tipping point. And then after that, it becomes self-organizing and it skyrockets. That's exactly what we're seeing with complete streets. It's exactly what we've seen with separated bike lanes. Any number of things you can think about. U.S. cities, Vision Zero. So has everyone heard of Vision Zero at this point? Maybe a few? Again, it's this premise that in the city, no one should have to die or be seriously injured while traveling about. And it started with New York City, sort of late 2013. Mayor de Blasio just sort of created an edict and said, we will do Vision Zero. And then San Francisco followed. And now we're starting to see, we're at about 10 or 11% adoption. So 15% adoption is critical mass, right? So in the next few years, we predict that this will go exponential. We'll see almost every city doing it in just the next decade or so. That's a prediction. You can maybe, I don't know, bet on it now. It's probably a good bet, I would think. Yet, Vision Zero is one thing. It's not necessarily an approach. It's more of a goal, right? We want to get to zero. Safe systems is how we get to Vision Zero. And these are the countries that have sort of fully endorsed safe systems philosophy here. Very interesting kind of cases. And we've done some work looking and talking with people there, looking at their documentation, understand what exactly is it, what's their approach, and how can we translate that here in the US. Some of you may have seen this from earlier today. Safe systems deals with not just the top, the crashes, but what's below. The trends, the people moving to cities. Who's moving to cities? Who's moving to the suburban areas? What's happening there? Transportation and land use decision making. Who has power to make decisions? Who does not? Who has the information? Who does not? These sort of patterns that we're seeing, the system structure. And then under all, they call it the mental models that people have, but basically it's the philosophy. What is the whole purpose of the transportation system? If it's to get people moving quickly, that's one thing. If it's to get people to to participate in civic life, that's sort of a different thing, right? What is the purpose of it? So what we've done at CSSRS, or the Collaborative Sciences Center for Road Safety, we actually, the UTK is actually a partner with us in this. It's a consortium of 5 universities. We've developed these sort of pillars or principles of safe systems. And I'll go over each one of those very, very quickly. But the basic idea is that we adapt the structure and function of the system to the complexities of human behavior. And what I mean by that is we stop blaming individuals for what the bad mistakes that they're making, and understand that there are certain limitations that people have. There are certain natural proclivities that they have. The Uber crash in Arizona, does anyone remember that? That person walking a bike across the street, hit by an Uber, automated vehicle. There was the driver there, right? And a lot of the media blamed the driver. The issue with that is that there's something that's well known in certain fields, apparently not in automated vehicle land, is called vigilance decrement, which is a very fancy way of saying people check out after 20 minutes. If it's boring, you kind of check out mentally. There's nothing you can really do about it. It's human nature. If they knew that, then maybe they wouldn't have a driver in there, right? Expecting them to be alert all the time when they're not even engaged. You can kind of see this happening. You just predict that this would happen, right? Minimize the likelihood of road user mistakes. So you want to actually minimize the likelihood that they make mistakes, but also the severity, right? So graduated driver's licensing, going through the permitting process. You know, when you're 15, it's really a struggle to do that, right? It's annoying as heck, but man, it works really well because basically people are getting practice in the right conditions. The Dutch are just really gifted at training child cyclists. By the time they reach teen years, they're just super skilled and can handle any number of situations. Of course, we've seen in vehicle technologies, blind spot detection, and then there's even some conceptual things like green light speeds at intersection approaches, which basically at a certain point approaching the intersection, the car slows down. Something in the roadway, there's maybe a vehicle to infrastructure communication, and it just automatically slows the car down, because that's where we know road users interact in intersections. And so you prevent, or at least you minimize the likelihood that they're going to collide with one another. Again, the graduated driver's licenses principle, one of them is to reduce the number of teens in the car. So if something terrible does happen, it doesn't take out lots of people all at once. System redundancy. So this is something that the Dutch, the Swedes are very good at. If light at an intersection fails, there's something in the system to back that up. There's something that's intuitive in the system that you know what to do and how to behave, and you're still safe if something fails. And then, of course, managing traffic speeds, which is its own principle under safe systems. It's not the crash that kills people. It's the transfer of kinetic energy upon the collision. If you hit somebody, if you look at this graph here, depending on their age, of course, if you hit somebody at 40 and they happen to be 70 years old, they have a 70% chance of dying. For a lot of people, 40 miles an hour probably isn't that fast, right? So managing speeds, when we talk about really reducing the burden on society, we have to start talking about managing speeds to a sensible level. It not only...
Faster, not slower.
I'm sorry?
We're driving faster, not slower.
This is true. We're driving faster, right? That becomes an issue, especially in the transition areas. As you get off a freeway and you're going 75, getting into an area, a lot of times you'll see land uses along that transition zone into the city, and you have people crossing the street. People don't have, you know, when you are going 75 and you get off an on-ramp and then you start going 30, it feels like you're crawling, right? So you're not going to go 30, you're going to go 50. Well, 50 is a very deadly for people outside of vehicles, especially. So there's this idea of equifinality. There's many ways to really start managing this kinetic energy. Automated braking is starting to be in vogue in vehicle design. So when there's a detection of another car, a person, that there's automatic braking if someone's not paying attention or not quick enough to respond. And then again, the approach speeds in road user interaction zones. Basically, there are certain areas, usually at intersections and where there's high density of destinations. We know people are going to be crossing at random spots. Try to reduce speeds there. There's places where it makes a lot of sense to reduce speeds. Maybe others you don't have to focus so much on. Another one is basically an ethical stance. So treat road user safety as a foundation, not necessarily as a balancing act, as we tend to now. It's a balance between safety and mobility, right? We have mobility plans and we have safety plans. Oftentimes they don't coordinate. What do we mean by safe enough? We have to have these conversations. From a safe systems perspective, is that it's safe enough that if a crash were to occur, which inevitably it will, people will bump into each other and make mistakes. Is it going to be really serious? Is it going to be fatal? That seems to be sort of a good breaking point, right? Cut point there to say, that's probably safe enough. If they can survive that and they're not gravely injured, and then we can start talking about mobility, access. Basic safety is the foundation upon which we achieve all these other things. True mobility, access, comfort, and then this idea of equitable participation in civic life. So we know we have some disparities, right, based upon class, based upon race, about the environments that people find themselves in. Some are extremely unsafe and some are safe. So how do we sort of level the playing field, make it fair? And then, of course, because of this engagement in the civic life, you have enhanced well-being. So safe systems really think about this shared vision and coordinated action. So it's sort of the beginning of the talk, right? This is something by Rod McClure, as a researcher, looks at systems and starts thinking about, we need to start looking at the broader system of people working within a certain realm. So if you want to reduce the number of people driving under the influence, you've got to work with all the people that have any impact on that. Got to coordinate their action, get them working together, get them looking, creating the similar goals, right? So in a historical context, there's some interesting work by Peter Norton. He's out of UVA in Virginia there. He's done some work on sort of the paradigms, if you will, the underlying philosophies of transportation. Safety first, the beginning of the century, cars are introduced onto the network. You probably remember some of those early newspaper clippings of like the menacing car eating people on the road and things, right? You saw this. There's very much a narrative about drivers bear the responsibility for the safety of others. And then there was this era of control. So who has heard of the 5 or 6 E's, maybe part of Safe Routes to School, right? You think of education, enforcement. This actually started in 1920 with 2 things, actually. It was enforcement and education, and then engineering came on in the 30s. But they've been using the E's since the 20s, essentially. Then it became crashworthiness. Who remembers sort of the lawsuits against the car manufacturers, right, for designing unsafe vehicles? So then there was this focus on the crashworthiness of cars. And today, now we're back to basically where we started. Drivers, and now because the people moving about have become more diverse, the different ways that people get around, and individuals more generally. So the road users themselves are largely responsible for their own safety and the safety of others. Safe systems would actually represent a 5th. So the question really is, are we entering a new paradigm? I don't know, but it would represent a 5th of human-centered safe systems, safe travel systems. So this idea that the system is designed for humans. I don't know if you've heard of the statistic that 94% of deaths are due to driver error. Have you heard of this? If you have 94% due to driver error, you are not designing a system for drivers, right? The challenges we have is that our stance, basically, and I think others at UTK and would endorse this, is that in order to get to Vision Zero, we have to have this sort of safe systems approach. Otherwise, Vision Zero becomes a label upon which you just do what you've normally done, a slogan without substance, if you will. transitioning it requires a shift, as we discussed, basically on the paradigm. And that is really difficult to do. Really difficult. You can change a design manual, but changing the way people view transportation is really, really hard work. So I'll leave that to you guys, because that's exhausting stuff. So, really quickly, I just want to get over why we're a bit different than Europe. There's been some really interesting work from sociology mostly that look at this. We have two sort of forms of capitalism, actually. One we call ours competitive, or sometimes it's called corporate, and then strategic. And what I mean by that, in Western and Northern Europe, what they basically do is have very strategic relationship between business and government, where they align goals and they set performance measures and things together. Whereas in the U.S. context, it's the form of capitalism that we're attuned to privilege these sorts of things. There's sort of the pillars of it are, privileging private ownership of things over shared ownership, right? Pursuit of wealth and possessions is a very lofty and worthwhile goal. Unregulated markets and competition, right? You often hear about sort of the workings of the market. We don't need more regulation, things of that nature. So that's sort of unique to the U.S. context. So when we think about traffic safety, it's less technical, because I think we generally know what to do, or at least we tell ourselves that we know what to do, and more of a cultural issue. And the most central construct you can think of related to culture is our values. And this is some very interesting work, at least to me I think it is. So just very briefly, what are values? What are we talking about? As defined by the people that look at this stuff. I didn't make this up. Beliefs in something plus an emotion. So you can believe that the sky is blue. That's great. You might not have a strong emotion about that, but you believe that friendship is important. And you have a very strong emotion, right? They're universal, so every single culture has every set of values that we'll discuss in a minute. And they're shaped by our lived experience, so how we're basically socialized in our culture. The values, the way they structure, they've found these sort of 7 cultural level values, and they're structured in what's called a circumplex, which is basically a circle. They like fancy words for things, right? When you look at this, you see harmony, unity with nature, you see embeddedness, tradition. Hierarchy is all about authority, mastery, ambition. Affective autonomy is basically, hedonism, if you will, pleasure. Intellectual curiosity, and then egalitarianism, right? The interesting thing is they're arranged in the circumplex. Those near each other enhance each other. It's called the spillover effect, right? So you can think that egalitarianism, if you really talk about social justice, that actually also sort of blends in with unity with nature, world at peace. The more you see mastery values, for instance, if you privilege those, you're actually suppressing concern for other people, for nature, if that's a goal of yours or that's a value that you're espousing. Really interesting. And like muscles, the more they're engaged, the more our values are engaged through conversations, through social processes and things, they're strengthened, very much like muscles. So some of the work they've done is a lot of very cross-cultural work. And it's quite interesting. They've laid out the countries based upon their sort of organizing value, the one that rises to the top when they speak to people. In the US, we are firmly there in mastery values. And you can kind of see how this happens, right? We socialize people to be the best they can be, to use grit. And in Europe, it's more about sort of curiosity, intellectual autonomy, and also egalitarianism. You are the moral equal of everybody. You're no better or worse than anyone else. We're all equal. They're sort of socialized in that way. And it probably has some implications for our social policy, right? So when we think, hey, the Netherlands can do this, why can't we? It's because we're not them. We're oriented toward mastery. We're oriented toward ambition, achievement. Western Europe, they're more about sort of equity and social justice. So with this understanding that, okay, we saw earlier the countries that are implementing safe systems, how do we do it here? So the basic premise is that in Europe and Latin America, I failed to sort of reference them, but these central organizing values there are egalitarianism and harmony. Top-down, if their culture is already there, they can have these top-down national policies that relate to safety, right? It makes a lot of sense for them. So Sweden, they had this top-down policy, Vision Zero, 1997. The jurisdictions within Sweden are all going to do this, right? In our culture, because the top is probably going to resist that, and our culture is going to resist a top-down approach, we generally don't like being told what to do in the US. A more productive approach would probably be narrower policies in a number of different places to start working from the bottom up and change the way we have the conversation here. So some ideas, and I'm sure you guys have many more, is start looking at the institutions. Start looking at societal sectors, as we call them, professional organizations that deal with road safety or have anything to do with them, religious institutions, the media, how they talk about this stuff, right? We'll talk about that in just a minute. Schools, universities, federal agencies, state and local governments. If we can make changes and policy changes within these realms, multiple changes, multilateral changes, it'll all add up to something pretty grand. Upstream design, guidance, and training. Right now we know that civil engineering often doesn't include nary conversation about people outside of vehicles. We need to change that. We need to get this into the training. We're working to do just that. And then with the Collaborative Science Instead of Road Safety, again, UTK is on this team. Professional development and educational activities. So again, people are constantly looking for certification maintenance and their professional development hours. So how can we implement some of these ideas into those practices as well? And then looking at the non-traditional partners. There's so many people out there, and this morning we had a great conversation about this. Both who we're working with now and who is left out right now. Who could we be working with? So these are just some groups that we think we can start working with. There's many more. And then of course the use of language and frames. So a frame is really critical, and it's very subtle, right? It's a subtle selection of certain things. Suggests who's responsible, often evokes stereotypes and images. So you probably remember when the estate tax for those making $5 million or more in their estate became the death tax, right? Do you remember that? That was very interesting framing. Like they actually didn't change the nature of the program at all. They just changed the name and called it a death tax. So this is an interesting one. So this group called the Frameworks Institute, they're actually linguists and others who work on framing. They do this, they study this really closely. They asked people, they went out in the street and they actually videotaped people and said, what determines Americans' health? And this is just the CDC's map of the obesity rates in the states. They put this out every year. This is the more recent one. But what do you think people said when they said, what determines Americans' health? What do you think they said? Anybody?
They don't have choices.
Okay, they don't have choices. That'd be lovely if they said that.
Fried chicken.
Fried chicken, okay, yeah. Diet, yep. Diet, exercise, and smoking. Those are the top three by far, what people mention, right? And what do they all have in common?
Personal.
That's right. They're all about the individual, right? Nothing about the context in which individuals live or anything like that. It's all about the person. They call this health individualism. I think it's fair. So when you think about it, it is sort of a default for a lot of sort of our culture, right? To think that it's on us. You're poor because of your decisions you've made, right? But we don't consider the social, political, economic, historical mechanisms that create, maintain when we do this, right? When we say it's an individual's problem, we don't think about the broader context, and it's totally left out. So yeah, individualism, right? It's a word no doubt you'll be using at cocktail parties in no time, right? It's a wonderful thing to talk about because it's sort of a default, and we see it all the time. So this is just an example of safety individualism, as we're starting to call that, right? From the article, man in critical condition of being struck by a vehicle. First of all, apparently there is a driverless car out there striking people. not a driver of a vehicle, but by a vehicle. From the article, the car struck the man, again, a driverless car, evidently, due to the dark clothing he was wearing. When we looked at the place this happened, it looked just like what in that photo there. It was an exit. The person was there. They got out of the car to pick up something. There was terrible lighting in the area. It was slick roads, and the person was speeding. There was all sorts of contextual things that were just totally missed. And it related to, basically, boiled down to the person wearing dark clothing. And so, what do you think is going to happen when they say we need to start making investments here to improve the lighting? You know, they're going to probably not support that, right? Because it was an individual's issue. So the basic premise is that frames in the media and the way we talk about anything and any occasion, they determine people's understanding, as well as probably what policies they'll support or not. Right? Understanding of the issues relates directly to the policies that they'll support. This is a wonderful resource. It's a proceedings of a workshop. If you're at all interested in this subject, it's free. Framing the Dialogue on Race and Ethnicity to Advance Health Equity. So they talk a lot about framing in the realm of how do we get to health equity? How do we advance that? So within this, and applying it to safety, they basically propose a pragmatic argument. So one of the things we often hear about are the disparities, right, in safety outcomes. We'll say black cyclists are 10 times more likely to be struck and killed than white cyclists. Well, we hear a lot of these sort of reports. Instead, we need to talk about it in a different way and talk about that there's a problem, that we need to do something about it to make improvements, and that it benefits everybody when we do that. So instead of saying, this area is terrible to walk and this area is fantastic, this poor area is terrible to walk and the rich area is great, we say improving walkability for everyone, assuming that that's our goal already, right? We frame it in, we want to do this. How are we doing, right? When we do this, we put it in the terms of place-based fairness, which is really interesting. There's an interesting discussion on the use of equity. We've heard a lot about equity lately, right? But equity, I don't think there's a common understanding. A lot of people think of equity in different ways. So instead, we can maybe use terms like fairness. Place-based fairness might be actually a better term that is more has a more common understanding. So it puts a context within it, takes it off the individual, and puts it in a broader context, right? That's what our goal is. We should definitely try to do this whenever we talk about safety outcomes.
Do you have an example of that?
Yeah, this is an example here, but certainly anytime we have a crash report, let's maybe lobby for, thinking about the broader context, the environment that it happened in, right? Are there wide lanes that it happened in? Was this a big sweeping curve where the person could really, the driver could turn really quickly? What's the lighting like? Is there a good, safe place to cross nearby? All sorts of things, right? Take it off the individual and start looking at the broader context in which it happened. Yeah. And it's something we hear all the time. How many times have you heard, how do we change X group's behavior? You hear that a lot? How do we get people to do this? How do we get people to ride the bus more? How do we, right? We hear that a lot. Instead, let's think about how we can change their physical, social, and political environments to foster that change. Because right now, a lot of the environments are not sort of conducive to anything outside vehicles, or even if they are driving, to driving a sensible speed. A lot of times the environment is suggesting that we basically behave quite dangerously. The physical environment changes. This is something that is open source as well. It's the crash modification factors clearinghouse. The idea that when you put in something, what sort of crash reduction should you expect? There's a whole database on this that we update quarterly. This is for the Federal Highway Administration. And in it, you'll see things like these: road diets, rectangular rapid flashing beacons, protected intersections, which are just done in the Netherlands as an intersection, but we have a very special term, protected, for that. Raised median islands. All of those relate to certain crash reductions, and you can kind of look that up and find more information on here about the physical environment changes. Some other ones that don't necessarily have a crash modification factor tied to it, because That's really intense work. You often have to go to hundreds of sites with that treatment and compare it with hundreds of sites without it and do sort of analysis that way. These we know, based upon principles, very likely to work, sort of logically, I guess. Raised intersections, corner radii reduction, so tightening corners, leading pedestrian and bicycle intervals. We talked about that earlier on a Road to Zero webinar, which was exciting. Connected street networks, we know that the more we have this sort of disconnected networks, people tend to speed more because they're wasting time just getting places and things. And then the social, political, environmental changes, right? So graduated driver's licensing, like we referenced before. A lot of research is suggesting it's not about age necessarily, it's often about experience. 21-year-olds getting their license for the first time behave very much like 16-year-olds getting their license for the first time. It's about the experience they're getting. High visibility enforcement, all about the perceived risks. You think that there's enforcement everywhere. It's highly visible. Safety zones, you've probably heard some of these things. Slow zones, sometimes they're called senior zones. It's special populations usually, where children are, older adults tend to treat these places a little differently. We know that these work really well as well. Focusing our education and our interventions there. And then norm-based campaigns. So anytime you have more than half of people doing something, it's called a positive norm, and you can highlight that. And it gets more people who want to do that behavior. They actually did that with seatbelts as well. The goal really is this. We have the built environment, the physical environment on the left, and then on the right we have the more social, political. If we can coordinate efforts between these groups, right now they work in total silos. We have the educational folks, driver's ed, right? And then you have the built environment engineer folks and planners. They deal with that stuff. How do we work together? So the upshot here, some recommendations, if we want to start doing this stuff and getting toward the safe systems approach, is that we do need to start coordinating funding and action across agencies. So right now the funding is totally siloed. It's for department by department. Let's form a task force where there's a common pot of money. We work together on that. Speed reduction is a hugely politicized topic. Anytime we talk about speed reduction, almost always there's some pushback. We see a lot less pushback when there are special populations involved, and we frame it in a certain way. This is protecting children on their way to school. This is protecting those with disabilities or older folks who live in the area and are just trying to get to the grocery store. And of course, this idea of basic safety. If we can get to a point where we're analyzing and judging all projects by the basic safety that they provide, we'll be in a good spot. I always have to include monitoring and evaluation. Always have to know what's working and in what conditions it's working. So setting up systems so that we can start tracking what's working. Someone talked earlier is setting up a counting program for Tennessee. So thank you very much, sir, for helping set that up. We have to know how many people are out there walking, how many are biking, how many people are driving, and where they're doing these things. Because otherwise we don't really know the exposure side. And then of course, this local media, really avoiding this sort of safety individualism and start putting these crashes, these outcomes into broader contexts. So I'll just leave some useful resources. So the physical environmental changes, social political environment, as well as resources on reading more about safe systems. So with that, I thank you.